Hello, my name's Liz and I'm the head nurse of our canine surgical departments. I'm back with my part 3 of an IM longline sedation technique. So this is a life-changing technique in order to have a hands-off way of IM sedating a patient. So I will talk you through it. So the equipment that we're going to need is an extension line, so that is the long line, a needle-free port. I would say 5 or 10, I'd probably say 10 mils of saline, your sedation plan, your medications from that sedation plan drawn up in separate syringes and ready to go, a 1-inch blue needle, and then restraint. So this won't necessarily be like holding. This is going to be more a muzzle, a buster collar, even just leads. And then your IV equipment on a blue tray. I spoke about the blue tray in my part 2, which would be really helpful in a scenario like this. So how we're going to set this up. So we're going to connect the needle-free port to our long line. Calculate how much all of your sedatives, so say you've got dexmedetomidine and methadone, and that's going to come to 2 mils in total. See how many mils your long line takes. So ours in hospital takes 4 mils, so I've got 2 mils of sedative, which I'm going to flush into my line. And then now I need to flush a further 2 mils of my saline into the line. And you're just going to flush it through until it gets to the very end by your needle. You'll have your 1-inch blue needle on the end of your long line. And then with appropriate restraint, or distraction is normally what is needed in these cases. So the way I quite like to do them is one person walking. So if they're a strong dog, then we might have 2 people walking, because this could even be for a really nice friend, but we are just not able to restrain them because they're far too strong. They just don't like that touch. There might not necessarily be a bite risk, but this also works wonders for bite risk patients that we're not able to actually handle. So we'll have some people walking the patient, perhaps down a corridor. It could be outside if the patient isn't a flight risk. And then we're basically going to pop the needle in their lumbar area and then inject in, but from afar. I do have some videos to show you because this is quite a visual thing. But what I would say, so if you have 2 mils of sedation, your line holds 4 mils. Obviously water, like fluids, are going to mix. So ideally, you're going to want to be injecting a minimum of 3 mils into the patient. If they're not that reactive, you could probably get away with injecting 4. To be honest, I would find that most patients don't actually react when they have this. They might turn around for the initial needle entering, but then with the right distraction and coaxing at the front of the patient, they kind of forget, and then you normally are able to inject the full 4 mils. And yeah, it's quite easy when you know how. So I would just make sure that you have an adequate sedation plan, just so you're not having to repeatedly IM this patient. Obviously, the first time, they're not really going to know what's happening, so you kind of have the upper hand. If we then try doing it again, and then possibly further times, the chance of this patient falling asleep is very unlikely. They're just going to be getting more and more stressed. So I would just make sure that you have an adequate sedation plan to start with. The idea of the long line approach is that you don't restrain the patient. Like I said, you just walk them, whether that be outside, inside, or it could even be with the owners holding the patient, and then it's us that is the trigger for that patient. Only load the long line when you're ready to perform the IM. If you were to load it 5 minutes prior to you doing it, you would then definitely have to inject the full 4 mils or however much your long line takes into the patient. And obviously the 4 mils, it can be quite a large volume to some patients. So yeah, just load it just as you're about to IM that patient. So here are some videos on how to do it.
Ready?
So you can see that when I popped the needle in then, I paused. So I wouldn't necessarily pause for that long. You probably wouldn't even have that time to pause with some patients. You certainly don't have time to kind of palpate. That's why the lumbar is a very good area. It's a large muscle. So actually just like pop it in, step back and then inject. And then also this was a very empty ward. So the way I pulled the needle out, I wouldn't be doing that in real life. I tend to just hold the line and allow the dog to move forward, and then it will come out safely and it will be on the floor rather than up in the air. And then this is just the video from a different angle. So once you've administered the IM, you would then just find a nice quiet space for that patient to fall asleep. And then once they're asleep, you can then place that IV catheter and do whatever it is that you needed to do. So here at Langford Vets, we are part of the Dogs Trust Friendly Scheme. So if anybody else wanted to look into that, there is the link here for you to see. Thank you so much for watching. And yeah, take care.